tú piensas que porque tú tienes cáncer tienes que soportar eso. O sea, va a tener esos dolores y todo lo que estás viviendo a tu alrededor ser parte de tu vida. Pero realmente no ha sido así.
Misconceptions exist in understanding what palliative medicine is. The fact is that palliative medicine was organized around hospice care in the beginning of its existence. When people hear the word palliative, they think death and dying, but there was a big need for people to get supports through a very difficult time earlier in their journey. Times have changed, and palliative medicine does not need to be the medicine of last resort, but be on the forefront of their care.
I define palliative care as a multidisciplinary approach to providing great symptom management for patients and relieving burdens like stress, whether it's physical, whether it's mental, and really taking care of all of their needs and really encompassing many different specialties in order to do that.
Well, for instance, if you're depressed or you're not in the right state of mind, if you talk to these people, they know just how to lead you and they put you on the right path. A lot of people think that it's like an end-of-life thing, and it really isn't. It's there for support, and I think people really do need support.
I was suggested to seek supportive care because I was having a lot of trouble with the chemotherapy. The knowledge that Dr. Graceman has, he was able to bring the nausea and vomiting under submission. It changed my life.
Supportive care people know how to deal with some of the side effects that we do not know how to deal with. We have had tremendous increase in our satisfaction that we're doing the best we can for our patients.
Este grupo de médicos empezó a ver cuáles eran las dolencias que tenía, a hacerme ciertos exámenes, y pues con medicamentos lo íbamos disminuyendo a un punto tal de que yo llevo casi 6 u 8 meses de que mi vida prácticamente es normal.
Я совсем ушел в себя. Но после того, как я пришел к ним, я понял, что эту болезнь можно вылечить. И я стал еще упорнее заниматься спортом, двигаться, радоваться жизнью. И вроде живу нормально, сейчас все хорошо, слава Богу. Продолжаю лечиться.
So I'm really involved with patients, families, and caregivers every step of the way. We don't just see it as a patient, but it's a patient within a family or within a community. So any assistance that I provide for a patient, it's always alongside with family support and also caregiver support.
When I heard she had cancer, I mean, completely devastating. My wife, my children, we were recommended for supportive care. Actually, the experience was wonderful. As bad as what happened was, they were terrific. It's tough to do it alone. When you hear experience from other people, it means a lot.
Well, my husband really was always here. He was everything. He went through from day one, everything with me. When we come here, we come together, and they spoke with both of us.
Speaking and working closely with the treating oncologist is paramount to success. So it's a model of collaborative co-management.
So there's very free association. They're part of our whole structure. They're an integrated part. It's one structure.
I often am glad when we can control and help the patients to achieve the best quality of life in the manner that they personally define. But I mostly am feeling privileged and honored to be part of people's journeys and be part of their clinical family, I would say.
I would recommend supportive care to all the patients because I'm sure that they will be able to help you in one area or another.
They know what they're doing and they're very educated and they will lead you to the right way.
No hay necesidad de sufrir de dolores, de sufrir de una serie de cosas que nos dan a nosotros por los efectos de la medicina que es tan fuerte y además por los dolores que el mismo cáncer te da. Sí hay caminos para que esos dolores y estas cosas que te dan se aplaquen y para eso sí necesitamos el médico paliativo, definitivamente.